Have you ever had a skin problem that started small, maybe just a bit of itching or redness, and before you knew it, it turned into something uncomfortable, maybe even embarrassing, and you weren't sure what to put on it or whether you were making it worse? If that sounds familiar, you're not alone. Skin infections are actually more common than most people think. They can show up as fungal infections like ringworm, bacterial infections from small cuts or sweat buildup, or even irritations that get worse because of the wrong cream being used at the wrong time. And here's where things get tricky, because most people immediately rush to find the best cream for skin infection without first understanding what kind of infection they are dealing with. So in this conversation, we're going to break it down in a very simple, real-life way. Not medical jargon, not confusion. Just clear understanding that can actually help you make better decisions for your skin. Now imagine this for a second. You notice a patch of skin that's itchy and slightly red. Maybe on your arm, maybe between your fingers, or even on your face. You ignore it for a day or two, hoping it goes away, but instead it spreads a little or becomes more irritating. At this point, most people start thinking, what is the best cream for skin infection that can fix this quickly? But here's the truth that dermatologists often emphasize. There is no single magic cream that works for every skin infection. The real key is matching the treatment to the type of infection. Let's start with fungal infections because they are very common. Fungal infections often appear as circular rashes, scaling skin, or persistent itching. They tend to grow in warm, moist areas of the body. In these cases, antifungal creams are usually recommended. These creams work by stopping the fungus from growing and slowly clearing the infection over time. The important thing here is consistency. Many people stop too early once the itching reduces, and then it comes back even stronger. Now let's talk about bacterial skin infections. These are slightly different. They can happen when bacteria enter through small cuts, insect bites, or even clogged pores. You might notice redness, swelling, warmth, or sometimes pus. In mild cases, topical antibacterial creams are used to help reduce bacterial growth and support healing. But again, the important part is not guessing, because using the wrong type of cream can actually delay healing instead of improving it. Then there are inflammatory or irritated skin conditions that people often mistake for infections. This is where things get even more confusing. Someone might see redness or itching and assume it's an infection, but it could be something like dermatitis or allergic reaction. In those cases, using the wrong treatment can make the skin more sensitive. So you can already see why searching for the best cream for skin infection is not as simple as picking one product off a shelf. But don't worry, this is where clarity comes in. A dermatologist usually doesn't start with just a random cream. They first observe the pattern of the infection, the location, the symptoms, and sometimes even the patient's lifestyle habits, because things like sweating, hygiene, clothing, and even climate can affect how skin infections behave. Now, here's something most people don't think about. Even the best cream for skin infection will not work properly if it is not used correctly. Application matters. Clean skin matters. Duration matters. And yes, patience matters too. Many treatments take several days to show visible improvement. Some even take weeks depending on the severity. But people often stop early because they expect instant results. And that's one of the biggest reasons skin infections keep coming back. Another important thing is hygiene during treatment. If the skin is being treated, but the surrounding environment is not clean or dry, the infection can easily return. Simple habits like keeping the area dry, avoiding sharing towels, and wearing breathable clothing can make a huge difference in skin infection treatment outcomes. Now let's talk about something very practical. If you are dealing with a mild skin infection and you are unsure what type it is, the safest approach is to avoid mixing multiple creams randomly. This is something many people do, thinking they are speeding up healing, but instead they end up irritating the skin more. Instead, it's always better to start with understanding the symptoms clearly and seeking proper guidance if it doesn't improve within a few days. Here's another reality most people overlook. Skin is a reflection of what's happening inside your body too. Weak immunity, stress, poor hygiene habits, or excessive sweating can all increase the chances of recurring infections. So while creams help from the outside, long-term skin health often requires small lifestyle adjustments as well. Now, before you click away thinking this is complicated, let me simplify everything for you. When people talk about the best cream for skin infection, what they are really looking for is relief. They want the itching to stop. They want the redness to fade. They want their skin to feel normal again. And that is completely understandable. But the real secret is this. The best treatment is not just about the cream itself, but about using the right type of cream for the right condition in the right way for the right amount of time. That combination is what actually leads to healing. And here's something important to remember. If a skin infection is spreading quickly, becoming painful, or not improving after a few days of proper care, that is the moment to stop guessing and seek medical attention, because early treatment always prevents complications later. At the end of the day,